Good afternoon, everyone. I am really humbled by this opportunity to speak before you and would like to also thank the ladies, Filet Chiones and Aisha Cooney, who started the Women's March movement in Philadelphia in 1997. And now, 20 years later, Marielle and Emily picked up the baton to make this happen again here in our city. An intergenerational blend of millennials, baby boomers, seniors, young, black, white, brown, representing every nationality. As Maya Angelou said, we shall rise. We are rising together to take a stand and be unmovable on basic principles of respect, dignity, equity, and value. Our organization, we partner with a lot of community-based organizations and churches, and we conduct workshops focused on stopping teen dating violence before it starts. Based on to reduce the spiraling incidents of domestic violence that has become normalized in our country and is a public health issue. The same approach is used as we conduct parenting classes, integrating how verbal and physical abuse are traumatizing our children. We will not be silent. When sexual assaults are made by leaders of our country over the airways and through social media, contradicting the values of respect and dignity that many of us as parents convey to our children as character principles that must be a part of their lives. I remember being in lecture hall while at University of Penn School of Public Health, looking at the data showing the glaring differences in death rates and illnesses between blacks and whites, known as health disparities, and further learning about why those things occurred and the associated factors known as social determinants of health: poverty, physical environment, education, access of health care, and more recently, racism, being included by researchers and public health community. Finally, some 30 plus years later, after being there in that lecture hall, I became hopeful with the passing of the ACA, Affordable Care Act. We finally have a national policy legislation that targets improving access to quality health care services for all, regardless of pre-existing conditions, children's ages, expands development of health centers, tuition assistance to increase diversity of providers and cultural competency training. But as you know, the ACA is being threatened along with the availability of health centers that offer comprehensive prevention and reproductive care for women. We can't remain silent on these issues. Our issues, they do not stay inside a box. We as women will not stay in a box. We are joining together, viewing ourselves and our community holistically. By joining together, we can and will have an impact on shaping policy that is responsive to what we identify as our needs. We will leverage our organization and are creating a legacy of wellness, mind, body, and spirit initiative. With our partner agencies, we will stand and want to stand with you. The self-help principles that were infused into the fabric of the Black Women's Health Project in 1983 by our founder, Billy Avery, are integrated into the reproductive justice movement that was established by Sister Song. In fact, the Primetime Sister Circle program that we conduct is a self-help approach to improve the health disparate conditions that are effective in reducing blood pressure and weight and stress, that were developed by Drs. Gaston and Porter of the Gaston and Porter Health Improvement Center in Washington, D.C. It is one of the most effective programs that I've managed during my career in public health. We stand on the shoulders of women and men who have led the way, including Michelle and past President Barack Obama, who will be missed, but not forgotten. We must unite and work together to end racism, reduce poverty, improve education, ensure access to affordable health care and reproductive rights. As stated by Dr. Martin Luther King, of all the forms of inequality, injustice in healthcare is the most shocking and the most inhumane. Thanks again for the opportunity to share my passion and my thoughts. Thank you.